liver cirrhosis, very interesting for me. Patient came with a diagnosis of chronic liver parenchymal disease with portal hypertension. Complaints were abdominal tightness, more on walking and standing, swelling in the legs, warts on sitting, dyspnea on distension of abdomen, walking aggravates, stress about the disease, anxiety about the family, anxiety something will happen to family, pain in the liver region. He feels emptiness in the abdomen and he has to eat something for that. And he has lot of eruption on the scrotum. This was the more or less characteristic symptom. Homeopathy is beauty. First of all, these were taken: abdomen, liver region, abdomen distension, liver region, abdomen eating after, abdomen enlarged liver, fullness, chronic liver. These were common. Actually, first we saw something else. Male eruption, eczema, vesicular scrotum in. Only one remedy, chelidonium. My first rubric was male eruption, eczema, vesicular in scrotum. And the remedy is chelidonium, which is an excellent remedy for liver pathology. And then we saw other rubrics: abdomen, liver affinity, distension of the liver, eating after aggravation, enlarged liver, fullness, chronic liver, again fullness, inflammation, chronic liver, pain, liver region, lying aggravation, pain, liver region, anxiety about health, stomach emptiness, weak feeling, eating amelioration, stomach distension, eruption, crust, scrotum, 2 remedy, and eruption, eczema, vesicular scrotum, 1 remedy. Chelidonium covers all. 𝐿ICO also covers, but 𝐿ICO is not covering eruptions of the scrotum. So moment we saw chelidonium there, in Hindi it is called tube chamka. Immediately it should spark. Arey, chelidonium hai udhar, why not I read the chelidonium? This is the clue. How cardias differentiate from chelidonium. Chelidonium need not always match with the better by warm drinks. Then it is common. But chelidonium also has scrotum eruption. And how many patients of liver cirrhosis will tell eruption on the scrotum? Eruption at the groin at summer is common. But particularly at the scrotum, he requested me to examine, and it was only at scrotum. So that location itself becomes peculiaris and individualization. That we have to see with the remedy, and then we have to see generals. But here, if you are too much into sensation, and now if you say chelidonium is Papaveracea family, it should have sensitivity to pain and suffering, and opposite is numbness and insensitivity. It is not there, so I will not give it. That is wrong. Too much into the mind and sensation is not okay. So whatever is available, take it, apply it, see it, peculiaris symptom, and results are inevitable. Chelidonium 30, because mind was not matching so well, generals were matching. So I gave 30 3 times a day for 10 days. After 10 days, much better. No distension, eruption reduced, pain is no more. Yesterday only he came. Roughly, you didn't record, no? Yesterday he came actually. Simply doesn't matter. Suppose if I remember, because yesterday's bilirubin was 2, I remembered clearly. When he came, his bilirubin was 5, now it is only 2. Good appetite, and most important, time to time he was getting high fever and he was to be admitted. After this chelidonium, no fever with good appetite, and bilirubin came down to much below, meaning from 5 to 2. Again, the trick of the case was location of the pathology was peculiar. Few minutes more. So, secret of success in acute is just find out what is very peculiar, how this patient differs from other, and always try to individualize a case. If not on one symptom, at least 2-3 symptoms which matches. For example, in this case, scrotum pathology with cirrhosis of the liver and liver affinity. That is enough to prescribe chelidonium.